In this lecture, we're going to look at the posterior abdominal wall. So we'll look at the boundaries of the posterior abdominal wall from the lumbar vertebrae and the iliac crest, and we'll look at the muscles that form the diaphragm, psoas muscles, quadratus lumborum and iliacus. We'll look at the vasculature that's running up and down the posterior abdominal wall, primarily the abdominal aorta and the inferior Vena cava. And then we'll look at the nerves that are positioned on the posterior abdominal wall, and specifically the somatic nerves. We're not going to concentrate on the autonomic nerves just yet. We'll look at those towards the end of the course. So the posterior abdominal wall is a muscular region that sits either side of the 5 lumbar vertebrae. It supports the retroperitoneal organs like the kidneys, pancreas and duodenum, but it also contains numerous important neurovascular structures like the abdominal aorta and the IVC, like I've suggested. So let's have a look at the boundaries of the posterior abdominal wall. And here we've just got a schematic that's looking at the skeleton of the posterior abdominal wall. And you can see we've got the lumbar vertebrae here, 5, 4, 3, 2, 1. The 5 lumbar vertebrae that form the posterior abdominal wall. We can see we've got the 12th rib running around in this direction, and we've got the iliac crest, and we've got the pelvic brim around in this direction. So the posterior abdominal wall is really this region which we can see here. We can see it clearly in this posterior view as the posterior abdominal wall really being in this kind of area here. So we can see with some details, we've got the 12th rib and the diaphragm forming the superior boundary, and inferiorly we can find the pelvic brim, which is round about here. Anterolaterally, we've got the anterior and the lateral abdominal wall muscles, which we spoke about at the beginning of the course, and posteriorly we've got those 5 lumbar vertebrae running down in the midline. So this is the region on the skeleton that we're looking at. If we add muscles to this region, then we can still see the lumbar vertebrae. So we've got kind of 1, 2, 3, 4, 5 lumbar vertebrae running down here. We've got our anterolateral abdominal walls here, transverse abdominis we can see, and we can see we've got the diaphragm, which we can point out here, and we can see we've got these muscles filling this space on the posterior abdominal wall, lateral to the vertebral column. What muscles do we have? Well, we're going to explore these in more detail, but we have a series of psoas muscles. These muscles are running down immediately lateral to the vertebral column. We can see them here. We have quadratus lumborum, a kind of quadrilateral shaped muscle that is sitting approximately here. And then we have the iliac muscle, which is filling the iliac fossa of the pelvis. And then we'll look at a special communication between iliac muscle and psoas muscle, which is iliac psoas. So let's explore these muscles in a bit more detail. If we look at psoas first, this muscle originates from the transverse processes of the lumbar vertebrae on either side. It also comes from the lumbar vertebrae's bodies and the intervertebral discs, and it's running down in this direction, both the psoas muscles running down in this direction. Both of them insert into the lesser trochanter on the femur, and they actually insert into the femur, lesser trochanter of the femur, as iliac psoas, where they form a common tendon with iliacus muscle, which we'll see in a moment. But these muscles, psoas muscles running down here, sometimes we can have a smaller, just pick out a little tendon here. This is psoas minor, and the larger, deeper muscle will be psoas major. But these muscles are supplied by L2, L3, L4 lumbar nerves via the lumbar plexus, and they're associated with flexing the thigh in combination with iliacus via the iliac psoas tendon. They help to flex the thigh and help to flex the trunk when you're in a sitting position. If we look at iliacus, then the origin of iliacus is coming from the iliac crest. Here we can see the iliac crest running around here, and iliacus is coming away from that iliac crest, filling the iliac fossa. This muscle combines with psoas, like I've just mentioned, to form iliac psoas and attaches to the lesser trochanter of the femur. The nerve supply again is via the femoral nerve L2, L4 from the lumbar plexus, and the action is really just to flex the thigh. Because of its position on the pelvis and not running up into the vertebra of the posterior abdominal wall, it primarily flexes the thigh, whereas the psoas part of iliac psoas also helps to flex the trunk. So if we now look at quadratus lumborum sits lateral to the psoas muscle, as we can see it lateral to the psoas muscle. We obviously have a pair of these, one on either side. But it does actually extend deep to psoas muscle, attaching to the 12th rib and transverse processes of the lumbar vertebrae. So it's attaching to the transverse processes of the lumbar vertebrae, and then extends across in this direction, running between the iliac crest here and the 12th rib running up here. So it fills this space, and that's quadratus lumborum. It's supplied by L1, 2, 3, 4 nerves, and it's important in extending and laterally flexing the vertebral column. So here we can see quadratus lumborum. Spend some time looking at the diaphragm, and in the diaphragm we can see we've got this central tendon. This really is like a trampoline that enables the heart to move up and down as the diaphragm moves up and down with respiration, and we have those apertures within the diaphragm allowing the inferior vena cava, the so-called caval opening. This occurs at T8, the esophagus at the esophageal hiatus at T10, and the aorta via the aortic hiatus at T12. But what we can see is that the posterior aspect of the diaphragm also forms part of this posterior abdominal wall. We can see we have these crura extending, these slips of muscle that extend down onto the vertebrae, onto the lumbar vertebrae, helping to actually form this aortic hiatus. So here these crura are forming part of the musculature on the posterior abdominal wall. And then we have these lumbar parts of the diaphragm that are attaching to some arcuate ligaments that are where the quadratus lumborum muscle attaches to. So here we can see that the diaphragm has a whole number of parts, has the sternal and the costal part, which we're not really worried about because they're more anteriorly attaching to the sternum and attaching to the ribs here into the sternal and the costal part, this portion of the diaphragm. For the posterior abdominal wall, we're more interested in this lumbar part, which we can see originating from these medial and arcuate ligaments that are associated with the quadratus lumborum muscle. So here we can see the lumbar part, and also we can see the crura, the left and the right crura that are running down, as I mentioned previously, to attach to the lumbar vertebrae, and these are helping to form the aortic hiatus. And then, as I mentioned, we have these three important apertures. You can see the details on the screen: the caval opening, the esophageal hiatus, and the aortic hiatus at T8, T10, and T12. So the diaphragm is really important in respiration, obviously, helps to change the volume of the thoracic cavity, important in breathing, but it's also a significant part of the abdomen's posterior abdominal wall. If we look at some of the vasculature on the posterior abdominal wall, then we're going to return to the aorta, and we've looked at this already when we looked at the arterial supply to the GI tract, and we can just make reference to it once more before we explore some other blood vessels. But here in the midline we can see we have the aorta, we can see we have the celiac trunk, we have the superior mesenteric artery, and we have the inferior mesenteric artery. And these really are one of the three types of blood vessels that come away from the aorta. We can see that the aorta has this three vascular plane phenomenon. It has three vascular planes. You have the unpaired branches that project forwards and supply the GI tract. So here we can see we have these unpaired branches that are running forwards, and these are going to be our celiac trunk, or they're going to be our superior mesenteric artery, or they're going to be our inferior mesenteric artery. And these blood vessels pass forwards. We're then left with two paired arteries. We have these paired arteries that go to the viscera, see them here and here, and these can be our renal arteries that pass towards the kidney or pass towards our suprarenal glands. We then have some paired parietal branches, and these pass to the body wall. So these are synonymous with the intercostal arteries, the posterior intercostal arteries in the thorax. These are some lumbar arteries that help to supply the musculature along the posterior abdominal wall. So the aorta, we can see, passes through the aortic hiatus at about T12. We can see that it extends inferiorly, immediately anterior to the lumbar vertebrae. And then it divides at about L4, this region here, into two common iliac arteries. Divides into two common iliac arteries. The external iliac goes to supply the lower limb, and the internal iliac, which we'll talk more about in future lectures, enters the pelvis. We can also see there's a series of other branches that we haven't referenced so far, and these are your gonadal blood vessels. These would be the paired visceral branches that go and supply the testes in the male or the ovaries in the female. And there's your abdominal aorta. Sitting to the right of the abdominal aorta is the inferior vena cava. Now, because of the portal system, we don't have branches coming into the inferior vena cava like the aorta gave off. We don't have an equivalent of the celiac trunk, the equivalent of the superior or inferior mesenteric arteries passing directly into the inferior vena cava. Remember, they pass into the portal vein, which goes to the liver. But they do have some important branches. So the inferior vena cava receives all its venous blood from the lower limbs, does this by way of common iliac and the external iliac vein. It also receives blood from the posterior body wall via some lumbar veins, and it also receives blood from the pelvis via internal iliac veins. Finally, it's going to receive blood via the hepatic veins, which is taking blood directly from the liver. And we can see some hepatic veins positioned right at the top here. But we have quite a long stretch of the inferior vena cava that's not really receiving any venous input. What we can see is that it's formed a bit lower than the bifurcation of the aorta at L5. That's where the two common iliac veins form the inferior vena cava, coming up here and in this direction to form the inferior vena cava, and it ascends to the right of the aorta. It enters into the thorax via the caval opening, which is at T8. The main blood vessels that do pass into the inferior vena cava are the renal veins coming from the left and the right, kidneys. Importantly, we can see here that the kidney on the left has the left venal vein passing anterior to the aorta. The left venal vein receives the left gonadal vein, whereas the right gonadal vein actually passes directly into the inferior vena cava. So the inferior vena cava receives venous blood from the gonads, be it the testes or the ovaries, but the left one drains into the left renal vein, whilst the right one drains directly into the IVC. Receives suprarenal veins, which we'll explore in the next lecture, draining from the suprarenal glands, and it receives drainage from the liver. This is blood that is going to be full of nutrients that have been processed by the liver and returning it quickly into the systemic circulation. So if we remove the organs, the kidneys, the spleen, the pancreas, the suprarenal glands, if we remove all the organs within the abdomen and all the arteries and their branches, and we're just left with the muscles, we can see a whole series of beautiful nerves which are radiating away from the spinal cord through the intervertebral foramen. And we have a number of these somatic nerves, and these contain sensory and motor fibers that supply the skeletal musculature and the skin of the abdomen. So these are containing sensory fibers that are taking cutaneous information back from the skin, and also motor fibers that make the muscles contract. As it's somatic nerve that's passing to the body wall, there's also going to be some sympathetic fibers that control the hairs, that control the sweat glands, but we don't have any parasympathetic input. These nerves that are running down the posterior abdominal wall, and we can see a few here. We've got the subcostal nerve. This is T12. That's the last nerve to originate from the thoracic segment of the spinal cord. Then we have iliohypogastric and ilioinguinal. These are both derived from the L1 spinal cord segment, iliohypogastric and ilioinguinal. We can then see we have the genitofemoral nerve. The genitofemoral nerve is passing out through psoas major here. And the genitofemoral nerve splits into a genital branch and into a femoral branch. And these two nerves pass through psoas major. One then runs along the inguinal canal, runs within the spermatic cord of the inguinal canal to supply the skin around the scrotum, around the labia if it's in the female, and the femoral branch passes through the fascia of the thigh to supply a discrete region on the anterior surface of the thigh. The genitofemoral nerves come from L1 and L2. We also have the lateral cutaneous nerve of the thigh, which we can see radiating down here. We can have the obturator nerve. The obturator nerve is really important, coming from L2, L3, L4, and that supplies the adductor portion of the musculature in the lower limb, the adductor or the medial portion. It leaves the pelvis by passing through the obturator foramen and the obturator canal, which is a defect in obturator fascia. So it runs along the lateral wall of the pelvis, and we can pick up obturator nerve coming down in this direction and see it passing through obturator canal. That's important, like I said, to supply the medial compartment. We also have the femoral nerve, L2, L3, L4 again. And the femoral nerve, which we can pick up here, is quite a large branch. It runs lateral to psoas major muscle, and it extends down into the anterior compartment of the thigh, where it goes on to supply the anterior musculature of the thigh, so rectus femoris and your quadriceps. We also have the lumbosacral trunk, which is from L4 to L5. So we can see we have a whole series of nerves radiating along the posterior abdominal wall, which are really important in maintaining the function of the muscles within the posterior abdominal wall and elsewhere, and carry important sympathetic fibers to the body wall as well. They're also going to be containing cutaneous information via the sensory fibers, taking information about pain, touch, temperature back to the central nervous system. So in this lecture, which looked at the posterior abdominal wall, we've looked at the boundaries and the muscles that form the substance of the posterior abdominal wall, like the diaphragm, psoas muscles, quadratus lumborum, and iliacus. We've looked at their origin and attachment, nerve supply. We've then looked in a bit more detail at the abdominal aorta and its position, the vascular planes, and also the inferior vena cava. It's positioned to the right of the aorta and the tributaries that drain into it. And then we've looked at the subcostal nerve and the lumbar plexus, these somatic nerves that form on the posterior abdominal wall.